Let's welcome him in. Hi, Jimmy.
Hello there.
How are you today?
I'm doing very well, thank
Great.
you.
Well, we're here for your Prevora treatment, so come on in.
Thanking you.
Have a seat and get comfortable.
Wonderful.
Perfect. I'm also going to give you a pair of safety glasses just
Wonderful.
to wear as well.
And stylish, matches my shirt.
Provide you an oral health assessment. Therefore, I'm going to take a look at all the conditions inside your mouth, make sure they're healthy. What I see, sometimes we have some inflammation, which causes bleeding in our mouth, and we really want to be aware of that. The other thing I'm going to do, with your permission today, is an oral cancer screening.
Absolutely.
An oral cancer screening will help us to determine up front if there's any abnormalities that we're feeling, and mainly with our sight and with our touching of our hands. So I'm going to do that. I will be exploring down your neck, under your neck, and with inside your mouth.
Okay.
Okay?
All right.
And after that, I'm going to talk a little bit more what you can hope to achieve from having a Prevora treatment.
Wonderful.
All set?
Okay.
Okay, so let's get started. Look inside your mouth, Jimmy. Okay, so I'm going to start by palpating your glands along your neckline here. So just relax your jaw. Perfect. And if I'm doing anything that is uncomfortable, or you feel something that feels a little different, please just indicate that to me.
Wonderful. What does palpate mean?
Palpate means I'm using my fingers to circle around on the different glands and tissues to see if they feel a hard nodule, whether they move or they're stationary. So it's all the working of my fingertips, what I feel.
Okay. And why do we do this?
We do oral cancer screenings because oral cancer is one of the top leading types of cancer that we have that can be picked up at a very early stage to prevent the spread of it.
Okay.
That's correct, because usually when we actually see an outward sign of oral cancer within your mouth, it's in an advanced stage.
Okay.
Right, so we're trying to, get it in an early stage so that if we see something, or just, there's something that we're going, hey, I'm not sure if that looks right or not,
right,
we can send it off to a specialist then to further investigate it on your behalf.
And just so I understand too, I, the person, wouldn't necessarily feel any discomfort. No.
So if you had a sore that came up in your mouth, you might think it's a pizza bird or popcorn kernel got stuck or something, but it doesn't go away in 2 weeks. That is a sign that you need to have it looked at further.
Okay, interesting.
So the mouth heals very quickly. So even if you burnt the roof of your mouth, within 2 weeks, that should heal. If you have a tickle at the back of your throat, it's really common for people to say, it's just something caught in the back of my throat. But if that doesn't clear up in 2 weeks,
right,
because oral cancers, base of the tongue, back of the mouth, really down into the throat itself. So it's not something that you're just going to pull back your lip in all cases and see.
Okay.
Right? And even a canker sore should disappear. It's a virus, should disappear within and start looking better within 2 weeks.
Interesting. Interesting. These are those things that you think you know, but maybe I didn't know that.
Yeah.
I didn't know that. Okay, wonderful.
Perfect. So we're going to look at all the tissues. So I'll be again taking, you can see my finger, I'm taking it around and feeling through the lips and the cheeks, making sure everything feels healthy. I look with my near as well to look at color within the mouth. Obviously, different signs of cancer will either appear red or they'll appear whitish in color. There's all different things that we're looking for when it comes to the tissue itself. And again, as I said, the tongue is really important. So we look at the base of the tongue and we feel the glands from underneath and along the bony ridge there on both sides. And then I'm going to let you relax your tongue for me down. I'm going to get you to say a big ah. That opens up the back of the throat so that I can see to the very back. Okay, so the next thing, I'm going to ask you to stick your tongue out. I'm going to grab it. And I'm going to rotate it from side to side so I can see underneath and on the sides. Great. So everything is looking quite healthy in there. Nothing to be alarmed with. I see nothing that comes to the forefront that I should be concerned with. So I feel very confident that things are looking healthy inside your mouth.
Wonderful. Let's do some Prevora.
Yes, so I just want to explain to the viewers out there that could be watching this what we're going to be doing. So Prevora is applied to the tooth surface. So we will be taking a little micro brush and actually applying it not only to the outside surface, the inside surface, but actually in between all the teeth as well, so that the coating is on all the teeth. So the first one is invisible. It's a clear liquid that goes on. It's a chlorhexidine base. We put it on all the surfaces. We quickly just then air dry it. We do want to isolate each of the sections so that they stay dry and the product goes directly onto where we want it to be. And then we go to stage 2. Again, another liquid, but this one seals in the chlorhexidine onto the tooth surface so it has a chance to work. The longer we leave this product on our teeth, the better.
Bev, tell us what you're doing.
I am dispensing your Prevora now for you behind me in 2 different wells to keep track of them. The first stage will appear a little bit brownish in color, but you won't see that on the teeth. And then the final one is a milky color. So I have 2 different colored tips here for application so they don't get confused as well. Okay, so I'm gonna lay you back a little bit further, Jimmy, so I can see you here. Okay, so we're going to start on the bottom left-hand side here. These are just cotton rolls. They're going to go one in your cheek and then the other by your tongue here, just to keep it dry in there. We dry it off. Perfect. Thank you for staying open. First stage on. So we lay it up on the gum line, in between all the teeth. You want to dab it in between the teeth so we can get into lots of spaces. Okay. A little bit of air in there. You may feel a little bitter taste that goes away very quickly. I will let you rinse out at the end with some water. Second stage now going on. Again, the same thing. I'm going to apply it along the gum line, up the tooth, and dab it in between all the tooth surfaces. And then we'll air dry that again. Good. And we'll move on to the next area of your mouth. People who have dry mouth will have that from people who have been going through any cancer therapy because their saliva glands are affected. Those people, the bacteria and the pH level in their mouth is really out of balance, and they are the first to get a lot of root decay happening inside their mouth. The saliva that we produce naturally is what keeps, our pH balance intact and helps us to, make sure that we don't get decay. So those people, so if you know anybody, going through cancer therapy, those would be excellent candidates. This product is widely used at Sunnybrook, Toronto General. All the cancer specialists in Toronto use this for all their patients before starting treatment.
Why?
Because they're such at risk. They have lower immune systems based on what they're going through, and we don't want this bacteria. So bacteria is on the outside. When we have bleeding gums, that bacteria enters through into the bloodstream and through our saliva and travels throughout our body systems. That's why it can affect your heart, your lungs, any of your major organs inside your body. So we really want to keep everything as healthy as we can. This is a game changer, as I said, to keeping health inside our body, our mouth. I tell people this and they kind of shake their head at me. There's over 300 different strands of bacteria in your mouth alone. 300, that's a lot of bacteria to fight off. Okay, we're almost finished the bottom, Jimmy. You're an excellent patient. Here we go. We're doing the top, then we're gonna go onward to the top. Again, same process repeated over and over again. You will feel like your teeth have gum stuck to them all. That's the feeling you're going to get at the end of all this. Just going to air dry that last one. 1 second. Perfect.
And Bev, I know the hygienists who are watching are squirming in their chair because I keep talking while you're doing this. But I want to ask, if I'm somebody who hasn't been to a dentist in a few years and I'm worried about what's going on or I'm concerned, what kind of difference could a Prevora treatment and an assessment or cleaning from Gift from the Heart make as a first step? Just talk to me about the difference between not being to a dentist in a while and what Prevora could do as a beginning point on the journey to good oral health care.
Sure, I'd love to talk to you about that. So first step is the biggest step of all to me, and that's picking up the phone or sending Gift from the Heart an email to say, I'm interested, tell me more. Once we get to that stage, that is critical, right? Then we can share with them, what we're able to provide for them. And again, just having someone look at your mouth to, take the concerns away. Am I having any problems? Do you see anything in there? Should I be concerned? That is, a big part of it. That's why we worry so much, is because we really don't know. We need a professional to take a look inside our mouth. So having that, assessment done, another word for assessment is like a look and see, right? We're going to take a look and see inside your mouth, and let's talk about what's going on. Let's talk about your concerns. What is it that you're worried about? Do you have some pain or discomfort? Do you have bleeding gums? What are your concerns? And Gift from the Heart will look at those and discuss them with them. Sometimes it's just nice to have someone to talk to, right? And then, the same thing with the oral cancer screenings. We want to make sure that that there isn't anything alarming happening in there. That, if it is, we can, use our resources to find you someplace to go. That's key. We want to make sure that you're getting the treatment that you require.
Okay.
And then the last thing about it is, if there is some bacteria in there that is out of whack, as I call it, or just, too much of one thing over the other, then we want to, use, again, products that we have on hand. This Prevora is incredibly, amazing what it can do. It's critical. This will help to lower the bacteria. So possibly buying you some time before you have to make a major decision about what's going on inside your mouth. Two, remember that the fillings that we use now, the material that we use to put fillings in place is white or tooth colored. We can't put those in if the tissue is, inflamed, bleeding. We don't get the same results from putting it in that way. So let's get the mouth as healthy as we can first before we have to do anything else. Even if that is an extraction or removing a tooth that, has already outlived itself, in your mouth, then having the gum tissue in the mouth as healthy as we can will help with the healing process as well. So again, in every aspect, it's really important that we get the mouth as healthy as we can, because if your mouth is healthy, then your body, you are healthier because of that. Your mouth is the window to the rest of your body. So we really want to ensure that we start with the mouth, get that as healthy as we can, because you'll feel better. People who have had this treatment put on will reportedly come back and say, oh my goodness, I'm feeling so much better. What did you use? And that's just because we are arresting the bad decay in there, allowing the good bacteria to start to, flourish inside your mouth. And with that, then the rest of your body can work on what it needs to do. We're in the last stage now, Jimmy. We're going across the front teeth now. It's our last part to do. And then we'll be done with your Prevora. It takes about 15 to 20 minutes, depending on the patient. You're an excellent patient. Even though you think you talk a lot, you're doing really, really well here. So it's all good. So here we go on the top ones again. Each of those canisters that I opened up are individual for the patient. We don't cross-contaminate. We don't use what's left over for someone else. It has a good shelf life on it, so we will continue to use this product that's left in the bottle for you, particularly as you keep coming in week after week. And as you said, you are at a stage where you are trying to come back from some past, problems with your teeth. So some people less often coming in. You, however, once a week for the next 3 weeks. Continue to keep fighting this bacteria off is really, really important. We really want to really help you out as much as we can with this bacterial label. You have some spots, gum tissue, as you said, isn't as firmly as attached. So we want to, you can see, especially in the front here, I'm really introducing it, right at the gum line between the teeth, around those gum tissues as much as I can with that chlorhexidine product. I'm going to air dry it again. Perfect. Last stage going on. And even though they're all colorful and thing, at the very end, when it's all said and done, you won't be able to see that anything is on your teeth. And there, a lot of people ask me, Jimmy, too, like, will this affect, like, if you have crowns or bridges or an implant in your mouth or anything like that? Will this help? Will this destroy it in any way, affect it? Or, no, not at all. This is a very, very safe product. In all the years that it's been used, there's been no adverse reactions from anybody. So feeling very confident. We at Gift from the Heart have known about this product for years now. Sort of let it ride out its course with other people trying it first before ourselves. And now we feel very confident to introduce it to the residents of the Bay of Quinte. So let me sit you back up now. Another happy customer. So let me just review again your take-home instructions for you, Jimmy. I'll take that from you. So with it, I am providing you this take-home instructions for yourself, which tells us, that you just had that coating put on your teeth, not to brush for 24 hours, to not floss for 3 days, which is sometimes a real win for a lot of people.
Yes.
Avoid some hard foods, like don't bite into an apple, carrot, things like that right away, because it'll just break apart on your teeth. And avoid the acidic drinks, so cola, sport drinks, things like that. And I would say, like, don't have a tea or a coffee right away, because
nothing
again,
extremely hot. Yes.
Right, because it'll sort of like melt it away.
Yes.
And then that's my battery. Just cut that out. And then we will be sending you home with a Crest Oral-B toothbrush.
And why are you sending me home with a new toothbrush?
Because we do not want, there'll be old bacteria
on the old toothbrush.
That's right. So some people can get rid of that by dipping it in hydrogen peroxide, but we want to start with fresh. Your mouth is now fresh with less bacteria after those 3 days or 24 hours. Start to brush with. We want to make sure that we're not reintroducing the harmful bacteria in your mouth. Give it every fighting chance that we can provide for it.
Absolutely. And if you don't mind, do you mind having a seat, Bev? I'd like to tell you something and then ask a question.
Yes.
And I just want to share something from like my perspective. So I know for me, when I was going through not going to the dentist for a number of years, the idea of my situation becoming worse was happening. But it was like I was stuck. And it wasn't until, I was forced to take action that I did. What I would want to share or convey to anybody who might hear this or become aware of this, that no matter what the starting point is, where you're at, if you are curious about where you stand, how bad is it? Because it might not be as bad as you think. It wasn't as bad as I thought it was.
Right.
It wasn't great, but it was. I could have taken steps earlier. And so I share that because in my mind, Prevora is a preventative action that anybody can take if they're willing to try, no matter where their starting point is. And if they give it a shot, that after 3 to 6 months, just coming back here to say hello and have another look in, as you refer to it, I would imagine and be very confident to say that there would be an improvement in just that action. This is the starting point, and we want to let everybody know that, and it's word of mouth, grassroots. It's going to start with one today, me, and we're going to have Prevora Day here at Loyalist on June 25th. We're then going to open up our doors in Brighton on June 26th, the next day. We're working to get this offered in Prince Edward County at the beginning of July. We've already got Trenton Memorial Hospital on the 16th of July. And so we're really excited to be able to take these milestone steps for Gift from the Heart and the Bay of Quinte community. And I just wanted to thank you so much for this time, because it was really nice. Thank you.
And I want to add too is that we were talking about first steps and not really, knowing what's happening in your mouth. And even if we only took that initial look and provided you with
some dialogue about where else you could go, that really eases the stress on the individual. Because, you know, right now we know that a lot of the phone calls are not answered by live people. We don't get that one-to-one. This, as you can see, is a one-to-one. There's no one else listening in. You don't have to be afraid that your information is going to go anywhere else. We just want to have a conversation with you to help to ease any misgivings that you might have. If we can even teach you just about oral hygiene care, provide you with a toothbrush or something to take home as the first step until you feel comfortable. We don't have to do all this in one appointment. We can do baby steps until you feel comfortable coming in and then exploring the next possibility. So as I said, the first step is making that initial phone call, coming to one of these free days that Jimmy talked about. Just make the initial step, even if you just want to come and meet us. That's great too. So we'll work along at your level, not on what the industry level is. So I just want to share that with people, because at Gift from the Heart, we are a nonprofit charity that's here for the people. Okay, we're not here to make money or to do anything else. We're here to fill the gap in the systems right now that exist, and we really want to help you out.